MAKO surgery for hip and knee replacements is much more precise. There's a CT scan organized to map out the anatomy of the bone and the joint, and during the operation, the tension of the ligaments are assessed and the points in the joint are recorded to match the CT scan, and the robotic arm decides on the optimum place to place the joint replacements and executes the bony cuts, with the surgeon controlling how they would like the ligaments and the soft tissues to balance out. During the operation, it's very similar setup to a normal hip and knee replacement. There are 2 extra pins that goes into the bone to be able for the robotic system to register points in the joints. Then these are mapped out to the CT scan that's been loaded onto the robot, and they assess the tension of the ligaments in the hip and the knee. After that's all recorded, there's a plan that comes as to the best way to cut the bone to allow the implants to be put in an optimum position for long-term survivorship, as well as good tension in the ligaments and the soft tissues around the hip and the knee. It's difficult to be very specific about it, but I think with MAKO surgery, there is the precision of the robotic arm do not allow the saw to go into the soft tissue, so there's definitely less damage to the soft tissues, and this allows for earlier recovery. Patients who have MAKO surgery typically go home earlier, have less pain, and recover quicker in terms of pain and the need for painkillers after surgery. Really, anyone who has arthritis in the hip and the knee who can have a CT scan would be a suitable candidate for MAKO surgery. Most people with straightforward osteoarthritis are suitable, and it's actually a bit better for people with more complicated anatomy, because the robot can plan the surgery into much more precisely than manual instruments can do currently. Traditional systems have improved a lot, but they're not consistently accurate. The MAKO is consistently accurate from day one. The first case will be precise and accurate, and the ligament tension will be as a surgeon would like it to feel. Unlike traditional systems where there's a bit of variability in the patient's anatomy and ligament tension, and that can't be accounted for by using normal manual instruments.